Good afternoon, everyone. Thank you so much, Professor Ahmed, for that warm and wonderful invitation. You humbled me. Congratulations on this wonderful conference to you and Dr. Iman. So we'll jump right into the presentation. I'm happy to see so many familiar faces, colleagues and friends, and we're happy to have this presentation here with you today. So to start with, we always begin with the vision at Liptus Nutrition, because you as pediatricians hold the future generations in your hand, and the choices that are made for these infants will drive their development and their overall future. So our vision is to ensure that the next generation grows up healthier, smarter, and stronger. We all know the importance of the first 1,000 days in life, and nutrition is a key factor in this objective. Breast milk, of course, is the best nutrition. This is how we as a nutrition company begin every presentation. There's no disagreement that breast milk provides the ideal nutrition for healthy growth and development. But what we also know is that the nutritional content of mother's breast milk varies from mother to mother, and it's driven by her diet. Because we know the mother's dietary choices are the ones that influence the nutritional content of her breast milk. And it is for this reason that we have made available PediaMom, the only super premium milk-based nutritional supplement to support the nutritional requirements of both pregnant and breastfeeding mothers. PediaMom provides the nutrition that the mother needs during all stages of pregnancy and after birth. It contains the required amounts of folic acid, iron, taurine, choline, the omega-6, omega-3 fatty acids, along with dozens of vitamins and minerals. So when a mother uses PediaMom, she does not need a separate prenatal vitamin. PediaMom provides the necessary nutrition while she's nursing to enhance the quantity and quality of the mother's breast milk. Because according to the WHO guidelines, if the mother is not supplemented with a DHA component, her breast milk will be produced with levels of DHA below the global guidelines. So PediaMom helps to replace the nutrients that are depleted from her body during pregnancy and lactation. Because throughout pregnancy, the mother's nutritional requirements for dozens of vitamins and minerals increases dramatically and continues to increase when she chooses to breastfeed. So PediaMom supports breastfeeding by providing a double encapsulated DHA, the most stable form, folic acid to prevent neural tube defects and autism spectrum disorder, a micro-encapsulated iron, because iron is necessary at all stages of pregnancy, but only certain forms of iron achieve the proper levels of bioavailability, prebiotics for gut health, calcium and vitamin D with dozens of vitamins and minerals in a creamy vanilla tasting product that supports pregnancy and lactation. Contains the key quantities of the essential fatty acids, linoleic, alpha-linolenic acid, and double encapsulated DHA, dozens of vitamins and minerals, including crucial requirements of folic acid, vitamin D, calcium, iron, and zinc, along with choline and taurine, which help overall neurosystem development. The dose is simple. It's 4 glasses, 2 to 3 times daily. It has a lower lactose content for those that have any issues with lactose for better GI tolerance, and it is sucrose-free to reduce the risk of gestational diabetes and excessive weight gain. Now, if the mother is not able to breastfeed for whatever reason, then the PediaMill portfolio provides the unsurpassed alternative for PediaMill 1 and 2 and PediaGrow 3 for toddlers 1 year of age and older. PediaMill is the highest quality advanced infant milk formula made with super premium nutrients. The goal in developing the PediaMill recipe is to continue to try to get as close to breast milk as possible. We can never completely replace it, but we can get as close as commercially possible. PediaMill is made with a base of milk fat as the main fat content instead of vegetable oil, because I guarantee you there is no vegetable oil in human breast milk. And so we use natural milk fat as the base for the fatty acid profile of the formula. And this provides the added benefit of a naturally occurring beta palmitate. We've added alpha-lactalbumin among the main proteins in human breast milk. We've increased the omega-3 and omega-6 concentrations by 20% while maintaining a 1-to-1 ratio according to the global guidelines. We are the only formula providing a micro-encapsulated iron, which maximizes absorption and bioavailability with a double encapsulated DHA. Now, the milk fat component, the critically important part of the triglyceride, is the structure of milk fat is oleic, palmitic, oleic in the alpha, beta, and gamma positions. And so when we see here, having the palmitic acid in the beta position, that is the naturally occurring beta palmitate in milk fat. Historically, vegetable oil was the sole source of fats and fatty acids. And companies would use a blend of a variety of vegetable oils. But technology has advanced. We now have the ability to produce a formula made primarily with milk fat because animal fat is the primary fat in human breast milk. And the goal is to try to get as close to breast milk as possible. So when we look at the palmitic acid concentration, human milk has about 70%. Cow milk is 40% and vegetable fat is 13%. So when we use cow milk as the primary fat constituent, we add about a third of vegetable oil to get the proper fatty acid ratios. Now when we look at the triglyceride of vegetable fat, it is reversed. Instead of oleic, palmitic, and oleic, it's palmitic, oleic, and palmitic. In milk fat, it's OPO, oleic, palmitic, oleic. And this becomes very important because when the infant ingests a pure vegetable fat formula, the palmitic acid in the vegetable formula is broken off. This binds with calcium because it has a very strong affinity for calcium, and it forms insoluble calcium soaps. The insoluble calcium soaps are not absorbed and causes constipation by reduction of peristalsis. Whereas in our formula, when we use milk fat as the primary fat source, the oleic acid is broken off. Oleic acid does not interfere with calcium, so you get full absorption of calcium, and you get full absorption of the beta palmitate, the palmitic acid in the beta position of the triglyceride. So you have proper absorption of calcium and fat, leading to softer stools and better bone accretion and improved energy intake. So the predominant fat in traditional formulas is vegetable fat, which causes constipation, colic, reduces calcium absorption, and reduces fat absorption. In the milk fat formula in Pediamil, our fat structure of the triglyceride is closer to the triglyceride structure of human milk fat. And so this leads to better calcium absorption, which provides better bone development, lowers the incidence of constipation, and lowers the incidence of colic. Now cow milk, because it has the palmitic acid in the beta position, has a natural beta palmitate. When companies add beta palmitate, that comes from a vegetable oil source, palm oil. And the production of synthetic palm oil-based beta palmitate causes derivative chemical agents that are not very healthy and can be chemical byproducts that are essentially harmful to the infant. And so we use no chemical or enzymatic process for our beta palmitate. It is a natural occurring milk fat with the palmitic acid in the beta position. So the benefits, to summarize, of milk fat in Pediamil: it's a natural ingredient. Cow milk produces natural milk fat. No harmful chemical byproducts because we do not use any palm oil in the production of our formula. It has the correct fatty acid in the proper section on the triglyceride in the beta position. It's a palm oil-free formula with significant amounts of fat-soluble vitamins, and we have a cholesterol content comparable to human milk, which supports early metabolic programming, which controls cholesterol synthesis and metabolism, that is easily digestible with a natural creamy taste. Studies show that if you provide cholesterol early in life, you properly induce metabolic programming. You increase cholesterol absorption while reducing synthesis and drive a homeostasis of cholesterol in the body. This helps to reduce the risks of cardiovascular disease later in life because the body is conditioned not to produce excessive cholesterol when the infant reaches adulthood. And so to summarize, the milk fat-based palmitic acid formula that we produce improves energy intake, reduces constipation, the calcium is properly absorbed so you have better bone mineral density, healthier gut bacteria, less crying, better sleep, and improved fine motor skills. Alpha-lactalbumin is an additional ingredient that we've added to pediatric milk. In human milk, alpha-lactalbumin is about 1/3 of the protein content in breast milk. In cow milk, it's about 4%, so we concentrate what's extracted from cow milk. And the benefits of alpha-lactalbumin in infants is that it helps reduce reflux, constipation, and abdominal pain. Furthermore, alpha-lactalbumin protects against pathogenic bacteria because it binds to the pathogens, specifically Salmonella and E. coli, and it provides a bifidobacteria enhancing effect on the prebiotics. The alpha-lactalbumin in Pediamil provides a protein composition closer to human breast milk, enhances protein digestion and acceptance, which drives better GI comfort, enhanced gut microbiota, enhanced immune system, and improved sleep rhythm. The third improvement in our portfolio was to increase AADHA concentration by more than 20% while maintaining a 1-to-1 ratio. Our formulas are fortified with the long-chain polyunsaturated fatty acids, and studies show infants that are fed formula fortified with these long-chain polyunsaturated fatty acids have cognitive outcomes at 4 years of age closer to what we find with the ideal scenario, which is the breastfed infant, both in performance and verbal IQs, and of course, the full-scale IQ score. When we look at the visual acuity of infants fed formulas fortified with DHA, the visual outcome is closer, again, to breastfed infants, 2021 against 2020 in breastfed versus 2024 in infants without these long-chain polyunsaturated fatty acids. The guidelines are that AADHA are provided in 1-to-1 ratio because if it's imbalanced, that can cause reduced arachidonic acid concentration in the brain tissue, the white matter, which impacts learning skills and memory and has adverse effects on growth and immune development. And so we maintain a 1-to-1 ratio of the omega-3 and the omega-6 fatty acids. This 1-to-1 ratio supports brain development, cognitive ability, IQ maturation, and visual acuity. Now, of course, as you increase omega-3 fatty acids, the fatty acid has a fishy taste and odor. And so there are challenges in this because fish oil can cause interactions, has low bioavailability, it's prone to lipid oxidation. And so because of that, we have provided a patented double encapsulated DHA to fully mask the taste and smell of the higher concentration of DHA. The DHA goes through an emulsification process which uses fish gelatin, starch, and lipids. First, there's a single shell protection around the DHA molecule. It is then double shelled using a patented power lock technology, and then they're cross-linked. This provides an enhanced double layer of protection of DHA encapsulation. The blend is a proprietary patented blend that provides higher concentrations of DHA while masking any unpalatability. And so Pediamil is fortified with a double encapsulated DHA, which protects it from oxidation, preventing undesirable aromas, supports solubility of DHA for better absorption, and this drives greater DHA bioavailability. The final upgrade is that we've provided a micro-encapsulated iron. We know the critical importance of iron in formulas and in diet. Iron deficiency and iron deficiency anemia are major problems around the world, and we've seen the studies that the incidence is quite high here in Egypt as well. The process of microencapsulation, we've taken a thin film of starch, sunflower oil, and lecithin, and we've encapsulated ferric pyrophosphate. This protects the integrity of the iron, preserves the flavor, it masks the metallic taste, and enhances the bioavailability and absorption of iron. In fact, microencapsulated iron is a water-dispersible micronized iron that's encapsulated to enhance the bioavailability. The iron is first broken up into nanoparticles, and then they are covered in this proprietary patented polymer to protect the integrity of the iron molecule and enhance the absorption. So microencapsulated iron masks the iron taste, the metallic taste, reduces GI irritation and constipation because you're not taking direct iron exposure to the GI tissue. It is encapsulated, so there is no GI irritation. It reduces interaction with other nutrients. It enhances the absorption of iron, reducing iron deficiency and iron deficiency anemia risk. And this, in the end, improves cognitive and psychomotor development, along with providing an enhanced immune function. Studies show that microencapsulated iron is greater than 100% more bioavailable than ferric pyrophosphate that is not microencapsulated. In fact, when we look at all salts of iron, it doesn't matter how much iron is in the formula. What's critical is how much gets absorbed. And so by providing a microencapsulated iron as the only formula that provides it, we guarantee a much higher absorption and bioavailability of the iron molecule. PDMIL is also fortified with 100% galacto-oligosaccharides. The 5 major nucleotides enhance immune response to vaccinations, and a balanced protein content to reduce the risk of childhood obesity. We have a vitamin C to iron ratio of greater than 10 to 1, which further enhances iron absorption, taurine for brain development, choline to enhance development of the hippocampus, which is the memory center of the brain, and we have a low potential renal solute load. Now we have our 4 specialty formulas: PDMIL AC, the anti-colic recipe with less lactose; our PDMIL AR, the anti-regurgitation recipe made with carabine gum; PDMIL HA, the hypoallergenic or our comfort formula; and PDMIL LF, our lactose-free formula. So PDMIL AC is our anti-colic super premium milk formula made with less lactose and milk-based beta palmitate for infants that suffer from excessive crying and abdominal discomfort. All we've done in PDMIL AC is reduce the lactose content by 50%, and we replaced it with maltodextrin. We still have the same milk fat-based beta palmitate, the double encapsulated DHA with the microencapsulated iron, the 100% GOS, and all 5 of the major nucleotides. The modifications of PDMIL AC for infant colic is by reducing the lactose content by 50%, we reduce any amount of lactose that goes into the GI where it ferments. The low lactose content in PDMIL AC with the high beta palmitate content reduces colic, alpha-lactalbumin enhances GI comfort, and the 50% maltodextrin as the carbohydrate helps to reduce the osmolality. PDMIL AC helps to reduce excessive crying and abdominal discomfort, has a beneficial effect on infant sleep compared to conventional formulas, and enhances gut microbiota by increasing lactobacillus and bifidobacteria counts. Our next specialty is PDMIL AR, the anti-regurgitation recipe, which is our thickened formula of stage 1. We've added carabine gum as a thickening agent to help infants suffering from recurrent regurgitation or GERD. Carabine gum is simply added to our stage 1. All the same super premium nutrients of the natural beta palmitate based milk fat, microencapsulated iron, double encapsulated DHA, and all the other super premium nutrients are included in the PDMIL AR recipe. Studies show that carabine gum helps to reduce esophageal acid exposure, the related symptoms of acid reflux, the total daily number of visible and measurable reflux, and body weight loss associated with excessive regurgitation. PDMIL AR is enriched with milk fat, and studies show that it positively influences GI tolerability, reducing abdominal distension and regurgitation volume, as seen here in this study over a 12-week period. Alpha-lactalbumin in PDMIL AR helps to reduce regurgitation and acid reflux as well. Our third specialty, our PDMIL HA, is our hypoallergenic recipe. It's a partially hydrolyzed super premium formula that provides the optimal nutrition for infants at high risk of developing cow milk protein allergy. What we've done is remove the casein content, and we've taken the whey and we've 100% partially hydrolyzed it using an enzymatic process to maintain palatability. It still has all the same super premium nutrients of the beta palmitate based milk fat, double encapsulated DHA with the microencapsulated iron, all 5 of the major nucleotides, and in addition, we have reduced the lactose content by 50% and replaced it with maltodextrin. So essentially, PDMIL HA is our comfort formula. When we look at the updated algorithm for the prevention of cow milk protein allergies, and of course I'd like to recognize Professor Gamal Sami and Professor Sana Yusuf for helping to create this algorithm which simplifies the step-by-step approach in determining whether hypoallergenic recipe is indicated for the infants. If breastfeeding is going to be possible exclusively for the infant, no further intervention or assessment is required. If breastfeeding will be partial, then before an infant formula is introduced, to supplement the breastfeeding, an allergy assessment and history should be taken. If it's not taken, then you should use a partially hydrolyzed formula. If the history of allergy is taken and there is no history of allergy in the family, or there's family history of one or more atopic family members, then you should use partially hydrolyzed formula. If there's no history, you can use a standard formula, or you can still consider partially hydrolyzed, because even infants with no family history have a 5 to 15% of developing cow milk protein allergy. So if the economics support it, the family can also be advised to use that if it's possible for them. And PDML-HA works by stimulating the immune system to accept cow milk protein. The whey is partially hydrolyzed enzymatically and the casein is removed. This enzymatic hydrolysis maintains a consistent molecular size of the peptide that is the most palatable and acceptable by the infant. If it is hydrolyzed using heat, the way some other companies do, this can cause a very unpalatable taste with a burnt taste and foul odor. PDML-HA with partially hydrolyzed whey protein and 50% less lactose helps improve infant GI tolerability and quality of life for infants and their parents. Reduces constipation, provides healthier gut bacteria with less crying and better sleep. Our last specialty formula is PDML-LF, the lactose-free formula. As the name implies, it is fully free of lactose. All the carbohydrate is provided by maltodextrin. It is lactose-free with no prebiotics because we do not want to drive increased peristalsis in infants suffering from diarrhea. Contains all the 5 major nucleotides along with zinc in additional quantities to help reduce the severity and duration of diarrhea. Before we finish up, I want to introduce you to our latest launch, PediaStart. PediaStart is our standard formula that provides all the essential nutrients for healthy growth and development. It is the highest quality milk-based formula made from the same cows that provide the PediaMill formula, but it is the only formula, again with PediaMill, made with microencapsulated iron to maximize iron bioavailability for proper mental development. PediaStart has a balanced protein content to reduce the risk of childhood obesity, maintains a 10-to-1 ratio of the essential fatty acids, linoleic and alpha-linolenic acid for proper brain and visual development. It's fortified with taurine to support brain and retinal development, with all the major vitamins and minerals for bone and muscle development, a low potential renal solute load close to breast milk, with a balanced profile of powerful antioxidants, including selenium at levels found in breast milk, fortified with choline to improve concentration, learning skills, attention, and memory, and inositol to help drive fat and glucose metabolism. PediaStart is available now. It has been available in Egypt since December, and we have made this available at 100 pounds per tin. That was the price in December, January, and February. Of course, with the exchange rate, the price will eventually have to go higher, but as of today, it is available at 100 pounds per tin, so that we are able to provide a more economically affordable product for families that cannot afford the super premium formula. So to summarize, our portfolio includes our standard formula, the only standard formula made with microencapsulated iron to maximize bioavailability in stages 1 and 2, the PediaStart. Our full super premium formula, PediaMill 1 and 2 with PediaGrow 3, along with the 4 specialties, PediaMill ACAR, HA, LF. And finally, and of course our most important product, PediaMum, for enhanced maternal and fetal nutrition to support pregnant mothers and enhance the nutritional content of mother's breast milk, which of course is the ideal nutrition for infants. Thank you for your attention.